Is medical tourism safe? The truth about traveling for healthcare. Hello and welcome to the channel. Have you ever thought about traveling abroad for medical treatment? Medical tourism, the practice of traveling to another country for medical treatment, has seen significant growth over the last few decades. Patients often seek procedures ranging from elective surgeries and dental work to complex medical interventions like cardiac surgery and organ transplants. In this video, I'm going to delve into the multifaceted world of medical tourism, evaluating its benefits and drawbacks, and providing a comprehensive analysis of its impact on healthcare systems worldwide. The rise of medical tourism. Medical tourism has emerged as a major industry driven by several factors. Number one, cost savings. One of the primary motivations for medical tourists is the substantial cost savings. For instance, a heart bypass surgery that might cost over $100,000 in the United States could be as low as $10,000 in countries like India or Thailand. Number two, quality of care. Many destinations offer high-quality medical care, often in state-of-the-art facilities. Countries like Singapore, India, and Thailand have hospitals that are accredited by international bodies such as the Joint Commission International. Number three, availability of procedures. Certain treatments and procedures that might not be available, legal, or have long waiting periods in a patient's home country can be more accessible abroad. This includes elective cosmetic surgeries and fertility treatments. Number four, tourism opportunities. Combining medical treatment with vacationing appeals to many. Patients can recuperate in serene environments, adding to the attractiveness of medical tourism. So now let's look at the advantages and the disadvantages of medical tourism. First, the good news. The advantages of medical tourism are many, multiple, both for patients and host countries. Number one, the economic boost. Host countries benefit significantly from medical tourism. It brings in foreign currency, it creates jobs, it stimulates the growth of related sectors like hospitality and transportation. For instance, Thailand's medical tourism industry was estimated to contribute over $3 billion annually before the COVID-19 pandemic. 2. Access to quality care. Patients can access high-quality health care that might not be affordable or available in their home country. This is particularly beneficial for those from countries with underdeveloped healthcare systems. Number 3, reduced wait times. Medical tourism can offer faster access to necessary medical procedures, reducing the waiting times that are common in public healthcare systems of many developed countries. Number 4, comprehensive care packages. Many medical tourism destinations offer comprehensive care packages that include not only the medical procedure, but also accommodation, transportation, and post-operative care. These packages are designed to provide a seamless experience for the patient, alleviating the stress of coordinating various aspects of their treatment journey. For example, in India, medical tourism packages include visa assistance, airport transfers, and accommodation for the patient and their companions. 5. Access to experimental treatments. Some patients travel abroad to access treatments that are not yet approved or available in their home country. This includes advanced stem cell therapies, alternative cancer treatments, and innovative surgical techniques. While this can be a tricky endeavor, it provides hope for patients with conditions that have limited treatment options at home. Now the bad news. The risks and drawbacks of medical tourism. Number one, quality and safety concerns. This has got to be the biggest one. Not all medical facilities abroad adhere to the same stringent standards as in developed countries. There is a risk of substandard care leading to complications or the need for corrective surgeries, which in the end increase the costs, thereby negating the purpose of the medical tourism in the first place. Number two, post-operative care. Follow-up care is a critical component of successful medical treatment. However, post-op care can be challenging for medical tourists who must return home shortly after their procedures. In this instance, it's probably best to already coordinate with your home doctor or your home healthcare providers before you travel abroad for the procedure, whatever it is. Number three, legal and ethical issues. Legal recourse for medical malpractice can be complicated, obviously, when the procedure is performed abroad. Patients may find it difficult to seek compensation or address grievances due to differing legal systems and regulations. Number four, cultural and language barriers. Communication issues can arise due to language barriers, potentially leading to misunderstandings about medical procedures and care instructions. Number five, impact on local health care. In some cases, the focus on catering to international patients can strain local healthcare resources, potentially reducing access to quality care for the local population. Now I turn my attention to specific countries. India. India is a leading destination for medical tourism, attracting patients from across the globe. The country's medical tourism market is expected to grow to $9 billion and more past the year 2025, with more than 500,000 foreign patients annually. India's appeal lies in its combination of high-quality medical care and significantly lower costs. Major hospitals in cities like Mumbai, Delhi, and Bangalore offer a range of services from cardiac surgeries to cosmetic procedures, often at a fraction of the cost in Western countries. In recent years, the fertility industry has been booming in India, with many couples seeking IVF flocking there for treatment. Thailand. Thailand's medical tourism industry is well established, particularly in Bangkok, which boasts world-class facilities and highly skilled medical professionals. Thailand's healthcare services are complemented by its hospitality industry, making it a popular choice for medical tourists seeking affordable and high-quality care. Singapore. Singapore is known for its cutting-edge medical technology and high standards of care. The country attracts patients primarily from other Southeast Asian countries and the Middle East. Singapore's healthcare system is consistently ranked among the best in the world, and its hospitals are well regarded for their advanced medical procedures and stringent regulatory standards. Mexico. Mexico is also a popular destination for medical tourists from North America, United States, and Canada, particularly for dental work, bariatric surgery, so operations such as bypass, stomach operations, etc., and cosmetic procedures. Proximity to the United States, along with significantly lower costs and shorter waiting times, make Mexico an attractive option for North American patients. Cities like Tijuana, Cancun, and Mexico City are key hubs for medical tourism. Spain, Czech Republic, and Greece. I mention these 3 countries together because together they are getting quite a share of the European fertility industry pie. They are industry leaders in Europe for new IVF techniques. To my knowledge, these are prime destinations for Swiss and other European couples seeking particularly fertility treatments. Malaysia. Malaysia has positioned itself as a premier medical tourism destination in Southeast Asia, attracting over 1.2 million medical tourists annually. The country offers high-quality healthcare services at competitive prices with a focus on wellness and preventative care. The Malaysian government has actively promoted medical tourism through initiatives such as the Malaysia Healthcare Travel Council, which ensures quality and safety standards across participating hospitals. Turkey. Turkey is known for its advanced medical infrastructure and skilled healthcare professionals, particularly in the fields of hair transplantation, eye surgery, and dental care. The country offers significant cost savings with hair transplant procedures costing up to 90% less than in the US. Istanbul is a major hub for medical tourists with numerous JCI accredited hospitals and clinics offering a range of services. Switzerland. Now, I had to mention my home country here, of course. Switzerland is known for a particular kind of medical tourism, a sad one. The establishment of many Dignitas clinics in Switzerland, where euthanasia is performed, combined with permissive laws on euthanasia, means that Switzerland is a prime destination for people with chronic, futile, and terminal illnesses who wish to end their suffering. What are the future trends in medical tourism? If you think about it, telemedicine integration would be a huge boost to this particular tourism industry. The integration of telemedicine in medical tourism would enhance the continuity of care and ensure that patients receive ongoing medical supervision even after returning home. In this sense, telemedicine also offers a convenient way for patients to seek second opinions and pre-travel consultations, improving the overall patient experience. Imagine having direct telephone or online access to your doctor, be they in the next road from you or across the continent on the other side of the world, wherever they may be. Wouldn't that be something? Number 2, focus on wellness tourism. The line between medical and wellness tourism is becoming increasingly blurred, with many medical tourism destinations expanding their offerings to include wellness and preventative care services. Wellness tourism, which encompasses spa treatments, holistic therapies, wellness retreats, complements traditional medical treatment and promotes overall health and well-being. This trend caters to a growing demand for holistic healthcare solutions and preventative measures. I can tell you that I'm all for that. It's not about treating an illness, a medical condition that you already have. I think we should also focus on prevention. Number 3, sustainable medical tourism. Sustainability is becoming a key consideration in the medical tourism industry. Providers are increasingly focusing on eco-friendly practices, ethical conditions or considerations, and community engagement. Sustainable medical tourism aims to minimize the environmental impact of medical travel, support local economies, and ensure that healthcare resources are not diverted away from local populations. I think this is a very good and viable consideration, which would only help to increase the importance on a worldwide scale of medical tourism, as well as its desirability. Personalized medical tourism. Now, advances in medical technology and data analysis or data analytics are driving the trend towards personalized medical tourism, and this approach tailors medical treatments and travel experiences to the individual needs and preferences of each patient. So we're not just talking about personalized medical tourism in the sense of bespoke travel arrangements, increasing a seamless and patient-centric experience, but also with increases in medical data technology, the possibility to have an e-dossier, an e-medical chart, electronic medical chart that is accessible by all your doctors, wherever in the world they may be. That is the key to encompassing all of the medical care a patient may be receiving, so that they're not restricted to just one local community or to just one country. Imagine if you have a whole team of doctors all over the world. Wouldn't that be something to behold? So, I conclude here. What do you think of medical tourism as it stands in the year 2024? Have you or someone you know been a medical tourist? Was it worth it for you? Would you recommend it based on your experience? Let me know your thoughts in the comment section below. Whatever you do, stay healthy.